We begin with developing news. Cases of measles are now reported to be at their highest level in 25 years. This as a pediatric patient in WIlbraham is now being tested for measles. Good afternoon. Thank you for joining us for Western Mass News at 4. I'm Dave Mattson. Now, this happened Monday. A spokesperson for the doctor's office in question says they're still waiting for results from the Department of Public Health. Beth Ward's here now with what we know so far. Beth?
A lot of people are asking a lot of questions about this case, Dave. We reached out to pediatric and adolescent medicine in WIlbraham. The practice posted on their Facebook page Monday about the patient being tested for a number of illnesses, including measles. As you can imagine, the post generated a tremendous amount of reaction, including much concern from parents. Monday's post from the Pediatric and Adolescent Medicine Office here in WIlbraham notified families that a patient was seen for a rash. Measles was one of several possible diagnoses. After much response, many from concerned parents, Dr. Amy Casper, who was working in that office Monday when the child came in, responded and shared her comments with Western Mass News, saying, first, the child in question was vaccinated. Secondly, the normal questions that we asked parents regarding children with rashes when booking an appointment did not give us information that would have given us cause for concern before they ever came in the door. Dr. John Kelly of Redwood Pediatrics in East Long Meadow has no connection with the WIlbraham office. He does tell Western Mass News since he began practicing in 1990.
I have never seen a case of measles, not in my training or since I've been in practice.
The same, he says, holds true for many physicians today. The number of cases had dwindled so much in the U.S. that in 2000, the CDC declared it eliminated. However, there is a new resurgence, the CDC reporting 626 cases in 22 states. Dr. Kelly says it's on every parent's minds.
Oh, yeah, lots of conferences. Just about in the last hour, I've had 2 6-month-old babies for checkups, and both parents asked me about that.
Measles, he says, can start with cold-like symptoms.
But the kicker there is that within 4 days of the onset of that, they're going to start to have a very classic-looking rash.
Now, he says, is a good time to remind parents to get their children vaccinated.
Those that get measles, 1 out of 1,000 will develop something called encephalitis, and they can die from it. It's an inflammation around the brain, and they die from it.
Back at Pediatric and Adolescent Medicine, Dr. Casper is hoping to reassure parents, saying current CDC protocols state that the measles virus can live in the air for 2 hours. We closed down the waiting room that the child was in for 4 hours, as well as the entire side of the building that the child was seen on for the rest of the day. Now, that WIlbraham practice says it immediately notified the Department of Public Health, which is protocol. The DOH says right now there is 1 confirmed measles case in the greater Boston area in the whole state of Massachusetts. And just this afternoon, New York City health officials, there's an outbreak there, reported 61 new cases since just late last week. If confirmed by the CDC, that would make it the worst year for measles since 1994. In the studio, Beth Ward, Western Mass News.